Well, hello and welcome everyone to the March episode of the bi-monthly FR Panorama webinar series. I'm Larry Liberti, and together with my colleague Mario Alanis, we will be hosting today's seminar. Welcome once again. We're thrilled to see you all today. In fact, you're one of 350 registrants to this meeting, representing more than 15 pharmaceutical companies from all around the world. More than a dozen regulatory agencies and almost as many NGOs, trade associations, and universities. So you actually represent colleagues from all over the world, from Asia, from Europe, North America, Latin America, Australia, and Africa. Welcome, everybody, once again. This webinar series was created to help stakeholders get a practical understanding of how to implement and refine or just consider the use of regulatory reliance pathways. FR Panorama is an educational program of the RUD Foundation. It's a 501c3 nonprofit organization and is the sponsor of not only this, but also the FR Path Project. So if you're interested in FRPs, we'd recommend you visit the frpath.org website. We're also grateful for the support provided by MSD for the FR Panorama series, but also we're indebted to our advisory committee for their input, their guidance, and the information that members have given us regarding the topics for each of the webinars. Today's webinar is the second of 6 webinars for this year. It's our hope that participating in these webinars, you'll get some practical advice to address your questions about reliance and to think more about the role and the benefits of reliance pathways. So we're sure that by now you have a basic understanding of the concept of reliance and that you're here to learn more about the practical aspects of how to measure the impact of reliance, which is the topic for today. But before I introduce today's concept of Relianomics and our distinguished presenters, I'd like to introduce it to my colleague, Mario Alanis. And Mario, over to you.
Thank you very much, Larry. Thank you for the introduction. You are right that we have seen a growing interest in the use of reliance all over the world, at the company level as well as at the agency level. However, despite the much work that has been done in analyzing and studying how to implement reliance, much less attention has been paid to the why reliance. And today, we will see that there remains much to be learned about how to assess, apply the practical value and the benefits of reliance pathways. So, Larry, let's get started.
Okay, looking forward to it, Mario. Today's session will last an hour and 15 minutes, and we hope that you'll find it to be an excellent use of your time. Feel free to suggest questions in the chat box, and we'll do our best to monitor this and to pose these questions to our guests during the panel session. So I'd like to start you off today with some thoughts about the concept of Relianomics. And so let's take a look at a couple of slides here. And I'd like to give you a bit of background here. As Mario had said, a lot of work has been done with regard to how to implement reliance. What are the best practices? Okay, but because myself and many of you out there have done a lot of work looking at reliance, you probably have recognized that the concept of why should we use reliance is, and how do we measure it, is maybe a little bit less understood, a little bit less the focus of some of the research. We know that reliance has many positive benefits. There's no doubt about it. But how can we be sure that regulatory reliance processes actually have an appropriate return on investment? A return on investment for the use in a particular category of products, or for a particular agency, or within a region. So, working with colleagues who I'll like to attribute at the end through Utrecht University, CRS, and Temple University, we're proposing this concept of Relianomics. So Relianomics, a new term. And we're terming Relianomics a structured framework for the assessment of the impact of regulatory reliance pathways. not only on the regulator and the regulatory process, but more broadly. Are there economic impacts? Are there societal impacts? And are there other systems we haven't even considered that get impacted by reliance? As we started to put together our thoughts around the Relianomics model, we came up with high level categories and then what we called subdomains. And we organized our thoughts around three areas: regulatory efficiency, economic impacts, and societal impacts. And you can see some of the subdomains that we've categorized, some of the characteristics that we think might be important to integrate into an overall Relianomics model. I can tell you that at this point, we don't have a formula, we don't have a calculation. The model is a framework, a way of thinking about a reliance and its benefits, and sometimes some of its downsides, because maybe we don't give that much attention to some of those items. From our preliminary research, which was based largely on analysis of publications and work that many have done, many have published, you've seen white papers in this area, we came up with the concepts that there are favorable effects and unfavorable effects. And with regard to the favorable effects, we could categorize them in terms of how they improve work efficiency, how they shorten timelines, how they can increase collaboration. But we also found some indications that sometimes maybe there are downsides. For instance, where decision support may be impacted in a way that we don't always think is positive. So we've heard and we've seen some work where people say, because of the use of reliance, a regulator may not get the experience that they would love to have if they were to do a more comprehensive analysis. So what we're trying to do is balance all of these benefits with potential unfavorable effects to say, when I'm thinking about implementing a reliance pathway, what are those benefits and what are those downsides? The beauty of this system is that it can be used by both a regulator and by industry to consider how they can best use a reliance pathway. We did identify a few metrics in the work that we were doing. Some of these I think you're very familiar with. We might touch on a few today. Things like time between a reference agencies and the reliance approval, or even market price change after approval. Redirecting scarce resources to areas of higher regulatory risk has been talked about, but hasn't really been quantitated. So, although many of the ones that you see here, researchers and others have come up with actual metrics to put behind them, in some cases, those metrics don't exist. It's just the concept. And if we were to move Relianomics forward, that's where we think it would be important, is to think about those metrics. Essentially, the Relianomics framework says we need to consider impacts, we need to consider metrics where they're available, and then we have to do an evaluation, which then helps us understand the benefits of putting a reliance pathway in place, using a reliance pathway from both the company and agency side, and what are the benefits to society and patients for doing this. So, what might be the next steps for a Relianomics framework? I think constructing such a framework or just identifying as domains is challenging. We spent months doing that little bit that I showed you. So, it's going to need some investment of time and resources and a lot of stakeholder involvement. We need to do surveys, we need to do a lot more around this. But we think this forms a starting point for a consistent approach to figuring out how to optimize the use of reliance based pathways. So ideas for the types of characteristics that could be integrated into the framework are out there, but we need to take those ideas and better understand them. And that's really what today's session is about. So with that, I'd like to thank my colleagues at Utrecht University, myself at Temple University, and at the Center for Innovation and Regulatory Science for helping with this research and for the input into this research. So that's kind of my background around Relianomics. And with that, I'd like to introduce you to our first speaker. And our first guest is Melissa Hunt. You may know Melissa from her activities at Health Canada, where she serves as the Director, Bureau of Metabolism, Oncology, and Reproductive Services in the Pharmaceuticals Drugs Directorate at Health Products and Food Branch in Health Canada. So today, Melissa will begin our session by introducing concepts around what approaches can be used by agencies to assess the value or ROI for implementing a reliance-based pathway. So she'll be giving us some of her insights because Health Canada has been looking into this quite a bit. So with that, Melissa, I'd like to turn it over to you. Thanks.
Thanks very much, Larry and Mario. I'm happy to be here today to talk about what approaches can be used by a regulatory agency to assess the value and return on investment for implementing reliance-based pathways. We have been using Reliance at Health Canada for some time now. It may not have been called Reliance. A decade and a bit ago, we were calling this use of foreign reviews, but it's not something that is strange to Health Canada. And we've been thinking a lot about how we can really measure the value of this. And it's a tricky question. So I don't know if we can put up my slides so everyone can see. Great. Thank you. So Reliance clearly has a value proposition, and this is taken from the draft Good Reliance Practices from the World Health Organization. I won't read through it, but it's very clear. We know that there is a value proposition when it comes to reliance for regulatory agencies, and that's the position that I will be speaking from. So what are some of the benefits to regulatory agencies when thinking about reliance pathways? We heard Larry mention speed. Faster access is always something that comes to people's mind, and that could be time to decision. So relative to other applications, it could be time to actual patient access, so thinking about the whole health system. It could also be faster staging in terms of the global filing plan. So, having Canada be the first of XYZ numbers of countries that the application is sent to. So lots of different ways we can think of speed of access. Another benefit is harmonization or alignment. So global clinical equipoise, of course, but also harmonizing processes and procedures, taking a moment to look at where we differ from other international regulatory agencies, and then asking ourselves and reflecting on whether that makes sense or not. Better decisions, it's something that we believe that happens when you had more people around the room, different expertise, validation of approaches. We believe that leads to better regulatory decisions. And then the leveraging of expertise that's unavailable to some. That said, it could also be the leveraging of expertise that is scarce. So we have, practical examples in Health Canada of this, where we do have pharmacometricians, but they are in short supply. So if we get the opportunity to leverage Reliance for that part of an assessment, that certainly does help us. Then there's the international connectivity, collaborative discussions, strengthening of relationships, and the benefits of that were quite evident to Health Canada throughout the COVID-19 pandemic, where some of the relationships we had cultivated over the years became very, very necessary to sort of move things along in a global manner. Then there are the spin-off projects that can really strengthen our regulatory processes, looking at joint IT projects, position statements, procedure development. All of this, I think, is a huge benefit. And then, of course, resource savings. I could put this at the top, probably. That's what people think about when we think about Reliance. Are we able to save the resources, save the time, save the people, and really kind of use that as a benefit? The little check marks are the ones that I believe to be a little bit more measurable and quantifiable. And it's something we've been thinking about. So we know there's a value proposition, we know there are benefits, but now how do we prove that? And that, like I mentioned, is a question that we continue to explore. What are the most useful metrics to demonstrate value for us externally, for industry? So we think about all of these things. So some of the indicators we've been considering are the hours spent per submission. So that really gives us a sense as to whether we are saving time, resource, etc. But we also have to think about integrating the hours that are spent on support activities as well. Because when you are doing work sharing, for instance, there is a fair amount of coordination and support that is required. So we do have to kind of weave that into our thinking when it comes to the indicator. And then we could look at the level of uptake of a pathway. How has that grown over the years, and why and who and what are we doing with those pathways to try to figure out maybe where we are best placed to use reliance. We could also look at decisions. Are we making different decisions? Are we aligned, and demonstrate benefit in that way? Speed is always a question. As I mentioned in the past slide, are we faster relative to other countries? Are we faster relative to our standard applications? But we also have to think about the velocity of review. So this was a lovely concept that was given to me by a colleague, where we're thinking about not only that metric of when we make a decision, but also how we did it within the application. So for our access work sharing, that is a very high velocity review. Even if you don't see a time savings with respect to our standard application times, we are asked to do a specific module in a compressed amount of time so that we can share and do some of the peer review. So we do need to be thinking about that as well. We can do kind of the bean counting, the number of files where we have leaned on reliance in some form. Maybe it wasn't a formal pathway, but maybe we were leaning on it in a different manner. And I really think that in post-market, this would be something that would be very relevant. We really do look at the global situation when it comes to pharmacovigilance. So I think that's really, really important. And then also the two-way street. And I think we don't talk about this maybe enough. How have we facilitated reliance? So, it's a give and take. And, in the pharmaceutical space, we certainly have shared reviews. But I think in other areas, such as inspections and in the medical devices space, we have also, to my understanding, allowed full reliance from other jurisdictions. So I think we need to think about that as a benefit and also demonstrate that as a value. But what about those intangibles? So the ones without the check marks, those are harder. And in this whole paragraph here, you see a far more question marks than you do periods, because it's not clear how we can really demonstrate those intangible benefits. But I do believe we need to be thinking about those. So we could be looking at really good case studies to show how these have facilitated some of those intangibles. But how we can measure the benefit of collaboration for policy development, IT systems, that's really, really a difficult thing, and one that we're still working through. But I do firmly believe that the more we use reliance in formal pathways and informally, we are going to be able to refine the way that we demonstrate return on investment and value to the multiple stakeholders who want to know that. And this is just a practical example, and this is just the time. So this is just looking at our standard application time using Project Orbis, the time savings. But we know from the previous slides that this is only one small part of the benefit of using Reliance and Project Orbis specifically. So what are we going to do next? We're really going to continue to look and believe in those value propositions and sort out how we can best demonstrate this return on investment, recognizing we probably won't get a perfect system, but recognizing how multifaceted it is, I think it's really important for us to try to articulate that as best we can. So I thank you so much for your time, and welcome any questions.
That's great. Thank you, Melissa. Really appreciate that. Melissa, I just have one question for you. Your organization has put a lot of effort into this topic, trying to figure out what's the return on investment. How do we go about optimizing the use of this? And how do you get input from the rest of your organization? You have reviewers and others who have their fingers in the pot every day. And if there were a recommendation around how to collect information and experiential examples, from the day-to-day operations, what might be things that we could consider, whether even if we're in a pharmaceutical company, how do we get input to know what people think about reliance?
That's a good question. And internally in Health Canada, we do have steering committees for various, initiatives that we have. We also have working groups that are specifically looking at how to come up with metrics to demonstrate sort of the progress, for instance, with the Access Work Sharing Consortium. And those have the people on the ground. So they have the reviewers, they have the project managers sitting around the table and inputting into what that could be. We also have our good review practices groups, and they are also sitting at the table, and they live in the world of metrics. We haven't, I don't think, come to the end of that, because even though we've been doing work sharing for many years now, at least since 2018, I believe. It takes a while to gain that experience on the ground. It takes a while to figure out what we need to do in terms of peer review. What does that look like? So I think it's only now that it's appropriate to be asking these questions and looking at what we've seen as a benefit, because there is a ramp up. And I think we're still not fully ramped up, but we're getting there. And I think it's now that we're going to start to see those benefits and be able to really make sense of those metrics.
Yeah, thanks for that. And that's really the gist of today's webinar, is that I don't think we could have had this webinar 7 years ago. We've evolved now to ask this question about, so what's happening? Why is it happening, and what do we do to optimize the use of these pathways, and how do we measure it? So I'm going to hand it over to Mario, because he'll introduce our next guest, who's going to give us a little bit of another perspective on this. And again, thanks, Melissa.
No problem. Thank you.
Thank you, Larry. Yes, indeed, I have the honor of introducing our next speaker. It's James Leong, who is well known to all of those following the role of academia in supporting the concept of regulatory reliance. In his role as head of education at the Center of Regulatory Excellence of Duke NUS Medical School, James contributes internationally to the development of applied best practices. He is privileged to interact with many agencies throughout Asia as they investigate ways to assess interactions among regulators across the region. So today, James will talk to us about APEC experience of using indicators to facilitate regulatory cooperation among regulatory authorities. Welcome, James.
Thank you, Mario. And thank you, Larry. So if I can have my slides on the screen, please. Thank you. Right. I think it's my pleasure, obviously, to be here and also to be speaking after Melissa. And thank you, Melissa, for bringing greater insights. And of course, it's a very timely opportunity right now for all of us together to really explore what is the value and how we can actually look into the value of regulatory cooperation. Now, I have 2 slides, in fact, just to help all of us to take a few steps back, in fact, just to understand what is regulatory cooperation. Now, many of us are familiar with the regulatory recognition, as in the EMAs, as well as Reliance, where we actually use the decisions from other regulators to support the decision-making of your own country's decision for the products itself. But obviously, across the entire scope of regulatory cooperation, it does include even very simple steps of information sharing, or else it could be joint assessment or work sharing. And in fact, for joint assessment and work sharing, many of you are very familiar with the successes of the consortium, the Access Consortium, and also the WHO ASEAN Joint Assessment Project as well. So, but why do we want to do this is because we always have limited resources. Nobody, including the US FDA, can claim they have more than sufficient resources, but how do we actually have effective use of the resources? And as Melissa has also talked about, how do we use this in the best area? And some of these areas, in fact, require more resources because it is, in fact, the local responsibility of the regulators to ensure all these roles are actually well taken care of. And in this slide, you will see some of these. So what we call the local NRA responsibilities. Pharmacovigilance. Obviously, nobody is going to track the adverse reactions in your own country except yourself. The quality of the products within your country, including good distribution practices, and also any other post-approval activities to audit and inspect the facilities within your own country, manufacturing products for the own country as well. So now at the end of the day, now most of us will actually think of about regulatory cooperation benefiting the patients and healthcare system. Well, that's right. But we really have to be a little more pragmatic and see, how does it actually benefit the organization, the regulatory authority at the very first instance. So why do we want to do regulatory cooperation? Why reliance? Now, I think it's important for us to see that two very simple components of here is really efficiency and effectiveness. Now, we want to have timely responses to provide drugs at a very good time, and that is what we call efficiency, to get rid of the operational backlogs and make sure there's access to at least essential medicines and medicines that's of good innovation to treat the diseases. And the second thing is effectiveness. Now, effectiveness over here refers actually to the duty of the regulators to ensure the safety, quality, and efficacy of the products. And this is quite different from the effectiveness I'm going to talk about later. Now, a year and a half ago, my center, CORE, actually it ran a workshop across the Asia Pacific. It was attended by 15, 16 economies. We look into the first workshop, we look into the implementation of reliance and the barriers. And secondly, what are the priorities for training in terms of technical competency to implement regulatory reliance. And just to cut the whole story short, we have a survey. And very interestingly, the survey showed that the regulators, they know about the option of actually referencing a breach route, which means that they can actually reference a decision by another regulator to support on decision. But they are now moving away from that, and they're now looking for a regional model, which means that they are actually not trying to prepare themselves. In what ways can they actually do joint assessment? In what ways can they do work sharing with other similarly sized or similar agencies in the same situation where they can move forward their own regulatory duties as well? So bear that in mind, because there's a slight shift towards about wanting just to reference a decision and towards a next step of a regional reliance model. So now, as part of the workshop, we also found out about what are the barriers, and not surprisingly, technical competency continues to be one of the key barriers towards implementation of reliance or regulatory cooperation. And then there's also one very important thing, which again and again, it keeps coming back to us, because we do realize that in fact, quite a number of regulators within this region are not of a ministerial status, which means that they're just part of the department under a ministry, which also means that they are not empowered to make a lot of decisions supporting whatever goals and objectives that they want. And because of this, the lack of political will and government support is actually cited as the #1 priority barrier that we wish to overcome. Okay, and notwithstandingly, they also hope to see there are more platforms to engage them. And this is really part of confidence building, where the regulators get used and get exposed to more opportunities. So now, based on this, I do know that the presentation asked for an indicators. So I sort of separated the list into a little bit less of indicators, what I call checklists, and the second slide will be more what I call measures or a proper indicator for an implementation. Now, first of all, checklist is important because I do think that in order to see regulatory cooperation happening, to see reliance actually being implemented, you must have all these that are on the screen right now. So I've tried, in fact, to color those in green as enablers and those highlighted in yellow as critical components. But the more I think of it, I think, I should have actually highlighted everything in yellow. So on the leftmost side, you will see what are the functional regulatory competencies required. And we look at the functions of there, the ability to conduct CMC evaluations, the ability to do benefit risk decision for the local population, conduct a risk management plan, and to ensure the practical implementation of this RMP, the ability to, and of course, a fully functional pharmacovigilance system, and of course, the capabilities to conduct audits and inspections as part of post-approval activities to survey the quality of the healthcare products. Now, these are the known capabilities that is required. I would say is the baseline assumption that everybody must be capable at before you actually take on regulatory cooperation. And this links back to the fact that, in order to do regulatory reliance on cooperation, it actually allows you to shift the resources to meet the very critical local regulatory roles, which is therefore those that is actually on the left. Now, if we shift attention to both the processes and the commitment, now, of course, we'll be asking for a new or revised processes to accommodate these new processes in order to just accommodate corporations. The list of reference agencies, I do know that quite a number of the agencies, in fact, has been asking us what is the rationale and how do we choose reference agencies. And in fact, this also become an issue of communication, I would say. When the industry asks why were certain regulators chosen as reference agencies and not some other reference agencies. So the regulators themselves must also be prepared to justify and have a good rationale behind their own list of reference agencies. Now, I will not overemphasize the need for convergence. So you can only rely on reference someone when your standards are similar. And I believe that I think Sandy will talk a little bit about this. So measurements and KPIs for convergence is definitely one of the I would say a measure of readiness, in fact. Now, Melissa also mentioned beyond just these platforms for approvals of medicines and the market authorization, there are in fact many other regulatory reliance on cooperation and other regulatory aspects and inspections, as you can see for the PRCS, APECs, and there are many other platforms which I think and strongly encourage all regulators to really consider being part of, because it helps you to form a comprehensive coverage of all the reliance across the regulatory functions. And lastly, and that this is something very practical that many regulators actually forgot that is very important. Now, in order to track and have proper metrics to be collected and collated, you do need a functional registry. Now, you need to have a functional database of the health products that registered. And when we talk about that, we need granularity of many columns that allow us to pick and choose the data that we need to see so that it can justify the use of reliance and also to showcase the effectiveness and also the value of implementation of the reliance over here. So in the lastmost column is actually on commitment. And I would say that this is difficult. I'm not sure I'm going to do that, but we do need support and we garner support for the regulators so that we can advocate the value of regulatory cooperation over the decision makers and back to the ministry, and communications internally and externally, okay, especially on the published timelines related to the use of regulatory reliance approaches. And accountability is something that perhaps is a very sensitive topic and also a topic that requires more openness and transparency about. And this also boils down to the fact that what metrics and what data we're collecting as a regulatory agency in terms of the approval timelines. And lastly, measures. Are we able to come up with measures that we can actually show that we have made good of the regulatory cooperation approaches that we implemented? So in this slide, I'll call what I call a proper measure of implementation. So going back to the proposed benefit of regulatory cooperation for the regulatory agency will be more on the efficiency and also the effectiveness. Now, first of all, I want to touch on the efficiency. And Melissa shared quite a number of the metrics. And I would say that these are common metrics, but the underlying assumption is that you must have a functional registry. Okay, and that is important. But secondly, I must also say that, none of this, in fact, has been truly validated, I would say, to be truly sensitive enough to pick up on the value of the reliance on how this reliance actually can be truly measured and the value can be truly measured, and which one of these is most sensitive to actually measure that value itself. So it's quite a bit of work over there, but I would say that the common metrics, in fact, has good potential, and we just need further study on that. Now, on the right side, I use the word effectiveness of implementation over here. Now, I do not want to confuse you with effectiveness of the regulatory agency, and that is to meet sort of the safety, efficacy, and the quality of the products. Now, I'm really talking about here the effectiveness of implementation, the implementation of a regulatory cooperation approach over here. So we can be looking into number of applications approved using the cooperation approaches, the number of applications, the number of regulatory partners, in fact, for joint assessment and work sharing. But lastly, we do know there are existing platforms and projects that's available. And I'm very keen to actually persuade, in fact, some of the regulators to say that, are you willing to actually participate in some of these projects? Because it does actually form a community where we could be freely supporting one another towards regulatory cooperation. Now, having said all these, and I just want to bring a particular emphasis on one particular element that's obviously and very often been neglected, is the investment in human capital. So while we're also interested in improving the system, interested in measuring matrices and numbers and data to support a decision, this is really at the expense of the staff, which in fact is really part of the system itself. So staff development frequently is not a priority amongst the NRAs. Lack of funding, lack of manpower to cover for those people who are going on training. And there's also a lack of, in fact, a structure to even develop them. And it's really very sad to know that as regulatory professionals or officers, it's not a truly recognized professional, and very little, in fact, is actually done to support the growth and the professional growth of all these officers within the organization. I think without achieving this, without giving a proper HR structure to grow and develop the staff, it is really difficult to support any initiative of regulatory reliance. And I think this shall be the last slide, and I do hope I provided enough thoughts for you. And I think these slides will be shared with you, and I'll be glad to answer any questions that you might have. Mario and Larry, back to you.
Thank you, James. That was a tour de force. Lots of really great information there. I have often been confused by this concept of effectiveness versus efficiency. And a colleague of mine once said that effectiveness is doing the right thing, and efficiency is doing that thing right. And the way you explained it, especially with regard to cooperation, is absolutely fits into that concept. So, do we have the right cooperative agreements? And then once we do, how do we measure those? Are we doing those well? Are we monitoring them appropriately? I just have a quick question for you. You talked about cooperation. We'll come back to this in the panel, but is there the need to have formal agreements in place for these kinds of cooperative elements to work efficiently? Do we need memorandum of understanding? Do we need cooperation agreements and letters of intent? Whatever they may be. What's been your experience with regard to, are they facilitators, or are they just documents that are there once you've got trust in place? It just formalizes the relationship.
Right. I would say that because there is commercial sensitive information being exchanged, and in protection of the commercial sensitivity and interest of the applicants, there obviously would be an expectation of official agreements amongst the countries, amongst partners. And I would say that do not try to make it too difficult. I would say that aim for the bare minimum that allows you to exchange information and allow you to share information in terms of joint assessment and work sharing. Now, what we have seen is that for example, I'm not against it, but with the WHO ASEAN joint assessment project, we do know there's quite a bit of administrative to fulfill. Okay, and that's one. And I would say that it is good a model because it does give you a very good structure in terms of what you have to meet so that you get a project ongoing. Now, Larry, I think you'd be very familiar also with the Access Consortium, now that UK, the MHRA has also joined. And in fact, those projects were carried out without much fuss because there were already MOUs amongst the agencies, and it just just need those to exchange information and just say that, well, company A, would you like to join this project? And it just moved on. And this is a stark comparison where you have something informal that worked, and you have something structured that worked as well. But of course, the thing is that there's lots more options available at the WHO. You get the support of the WHO pre-Q programs, you get the SRA's support, and you get many other people supporting as well. But the access level actually shows another model where it's a regional reliance model. It was a regional cooperation model where you get a few people together where they're comfortable working with one another. They have official documents that let's share information, get companies who are willing to provide the access for them to work on this as a project then you get things going quite fast. So I would not say that there's advantages. I mean, there will be disadvantages, advantages for either model. But at this point in time, to really ride on the momentum and interest in of implementing regulatory cooperation reliance in the region and every part in the world, maybe we should really pursue the path of the least resistance and have the simplest way moving forward.
I think that would be brilliant, wouldn't it? There is a question from one of our registrants, and thank you very much for what you've done. But they'd like to know if you could talk a little bit more about what the concept of a functional registry means. And I think when we come back together, we can talk more specifically about those registries. But just in general, can you just give some examples of how you've been data collecting and where you see some value there?
Right. I think, of course, the CRS is really the sort of the benchmark in actually understanding what these collection of data is. Now, having seen and talked and spoken to quite a number of regulators, in fact, they have a very rudimentary and foundational database. For example, the name of the product, when it was registered, what products and everything. It could have a few levels of other active ingredients. But we need more than that. We need to have like granularity in terms of when was the submission done, when was the first review done, when was the first screening done, when was the evaluation being completed. We need such a breakdown. And I do think that the CRS have actually lots of reports in terms of the matrices and what are the suitable metrics. And I will not even share even details on this because it's going to be another webinar on this. But without those, I would say that without having those details, it is not possible to actually show the value of the implementation and the value of reliance. So it's very important that we look back into the registry and say that, is this now fit for function? Is this now suitable? Do I get to collect data that I need? If not, quickly take a look at that and make some adjustments as much as possible.
That's great. And during the panel, I'd like everybody just to think about that. How can these data collection registries evolve? So we'll come back to that in just a little while. Thanks, James. Much appreciated. And Mario, thanks for the introductions there. It's now my pleasure to introduce our final guest, Ms. Sunny Chong. Sunny is the Senior Director, AP Regulatory Policy at MSD. And in her role at MSD, Sunny's been very active in promoting the effective and efficient use of novel regulatory pathways. So today she's going to provide us with her insights into the use of some regulatory indicators and some of the things that are going on in her region. So with that, Sunny, I'll turn it over to you and I'll help advance your slides.
Thank you so much, Larry. Hello, everyone. I'm very happy to be here. So what I intend to share will be 2 slides, and essentially telling you a story about a collective effort of industry. And the industry is a regional industry called APEC, that stands for Asia Partnership Conference of Pharmaceutical Associations. And APEC is regional in terms of Asia because the members consist of all the R&D based industry associations of the Asian economies. And you can see an image of the members there, 13 and to 14 industry associations. And APEC essentially what we decided to do together with our regulators during the time of COVID-19, and that was, for the past two years and so, we all faced the same challenge at that time. And with this long years of working together, APEC decided, let's reach out to our regulators. Let's discuss about how and what should be done during that time, in term to ensure that timely access of medicines can still reach patients. And so with that, we sent out letters, we have dialogues with our regulators, and and through that discussions and collaborations, we have seen reforms, we have seen changes made, and this is what we call inspiring partnership that brought about the ability to sustain and still being able to function efficiently during this very challenging time. So with that, we published this paper with the support of our regulators, and we thank them very much for their comments and reviews. So please feel free to read the paper with the link provided there. So what you will see in this paper, there are some areas that we have highlighted on what we call regulatory agilities to be implemented. And one of the agilities, there are 4 practices that we recommended and work together with our regulators. And these 4 agilities practices, the first one is reliance practice. This is where we are happy today to share with you the details on what these indicators are and how we measure them and what the progress is in Asia. So next slide, please. So there you go. A very colorful table you see here. And on the left, what you see essentially would be the economies, beginning with China, CN, Hong Kong, Indonesia, Japan, Malaysia, Philippines, Singapore, South Korea, Taiwan, Thailand, and we didn't manage to include India's progress timely for this paper's publications, but we certainly is tracking India's progress in terms of regulatory agility. So as mentioned, there are 4 practices of agility we recommend and work with our regulators, and you could see them figure 1A1 and figure 2 and 4. But for today's discussion, I would like to point you to figure 1A, 1B, 1C, and 1D, and these are indicators reliance pathways. So what the colors, quickly, what that meant is orange. Orange means it is still emerging. It's still underdeveloped. Emerging, the yellow one means something has been done, essentially for selected products. For example, green is this pathway is being implemented. And indicators we looked at for reliance at that time is really looking at implementation of reliance throughout the life cycle of the products. And so you find, for example, 1A looking at the use of reliance pathways in these economies. 1C looks at is reliance being leveraged to redundant retesting required upon importations. And 1D looks at reliance to also cover new indications and post-approval variations. So in a very nice way, the life cycle of smart regulations with reliance pathways. So that is the first indicator we look at, right? The actual implementations of reliance. And the second indicator we look at, also link quite nicely to reliance, is actually some of them you could see in figure 4, specifically 4A and 4B. So 4A, that's right. So 4A is about multiple DS and DP sites in a single license. So what that meant is, as Melissa mentioned earlier on, right, reliance is about the actual procedure of reviewing and also in other areas. And so this procedure of multiple sites in one license, we see that practice in ICH countries, in stringent authorities, in reference agencies, but very often in many parts of the world is one site, one license. And so this is not in line with best practices, and we think that to use reliance efficiently, not only just the pathway but also the practice has to align. So one of the very important practices is really the changing the practice from one site, one license, to multiple sites in a single license. Otherwise, you only have a quicker approval timeline, but you still are very much slowed down by the practice of one site, one license in many parts of the world. And the second indicator we looked at is what we call the requirements for site-specific stability data, 4B. So when you think about reliance, um, the evaluations already done by stringent authority is being leveraged. Um, does it mean that, well, well, theoretically it should be just a common set of data requirement, right? What does it mean when you need additional requirements? So we sometimes found, or very often we found, that for stability data, the data set provided to the stringent authorities, they make decisions based on that set of data, but that same set of stability data could not meet the requirements of the recipient agency. Instead, they want more stability data, additional stability data, and what we see there is this the understanding of stability requirement based on ICHQ1 is not harmonized across, and so we think that that this will slow down the use of reliance. Although we have the data set, we have the approval, it does not meet the requirement because the agency requires more stability data to be provided. And so we think that it's important to also track this indicator of more additional stability data. And so with this, you see the difference and the status of reliance pathway implementation in Asia, and also the requirements of the set stability data and multiple sites license situations, as you see here, shown in figure 5. And the status shown here is as of Q4 2021, and that is more than a year now. We are still continue to track the situation. The other indicator we think also is important is figure 1A. What that meant is, after the implementation of reliance pathway, is CPP continue to be required? Because CPP is a reliance tool, right? But if a country now requires public assessment report and the full data, the same data as we submitted to the reference agency to them as well, then what is the value of CPP? There is no value of CPP there. So CPP should not be required because it is not serving any value. So we also track this to see how many countries, after implementing reliance pathway, still require CPP. And we have seen, right, recently, for example, South Korea SK has removed CPP from their system, and there we color green. And also in our have featured very nice case studies. The first one is on the Philippines reforms, and the second one is on Malaysia's MPRA's, how they are really digitalization and modernization, even during the very challenging time. And so for the Philippines, for example, in Q4 2021, if you look at Philippines, you see that for reliance pathway, actually either emerging or developing. But as of today, I'm very pleased and very proud to announce that the Philippines FDA has now put in place a formal pathway that is 1B is green, and in addition, a very formal reliance pathway for the post-approval variations 1D. So both these two, they are now green. And the middle one of not related to reliance, but a feature on e-labeling. Again, we are very proud and very pleased to see that many of the regulators now indeed started an official channel in implementing e-labeling, and we are now working on our version 2 of this paper, hopefully to be published in 2024, to continue tracking the progress. And there you will, I'm very sure that the colors in this table will be dramatically very, very different, and essentially more greens than what you're seeing now. So with that, I end my presentation for now. Thank you.
Sandy, thanks very much. That was very detailed and very illustrative. Like you say, the landscape is changing from orange to green, and we need to continue to monitor that. We can talk a little bit more about that during our next session
Sure.
when we all get together. Mario, do you have any questions or comments?
Wow, Larry, it's been great presentations, all of them. I can think of different comments from everyone. This last chart, Sammy, was very illustrative, very detailed on kinds of issues that you as a company have observed, and it's certainly something that we learn a lot from. For example, from Melissa, it seemed very interesting to me that as an agency, they reflect if they are providing good information for reliance. I mean, this is not something that you would think of an agency developed or more caring for. And it seems to me that it's very important because often we hear how the public assessment reports are very different from each agency and they don't understand where information, and there is no standardization. So I just wanted to make these comments. I don't know if you have any reactions, Melissa or Sammy. Yes.
No reactions other than I think that we do need to reflect on that, where we're taking and then what benefit we're providing. And I don't think it's done that often. And I also don't think it's super quantifiable. So it's a really tough question to ask. But I think as sort of a medium-sized regulatory agency who has benefited from reliance, but also provided information out, I think it's worthwhile asking that question and promoting both sides of it.
You know, there's a interesting parallel to this, and I know James, you've mentioned this, is this concept of trust. In order for these activities to occur, for the kind of international connectivity that you've all talked about, there's this element of trust. Have we thought about how we measure trust? I mean, this is, you know, if I'm thinking about implementing a reliance pathway, yes, I have to have a reference agency, but not that we're going to come up with it today, but you know, I've often thought about how do we put our hands around who do we trust and why do we trust them, and what might be the things that we consider. And have you all thought about that? You know, when you're sitting around with a cup of coffee, is like, what are those things that help us understand trust and how that helps us then bring this international connectivity and leveraging together? So why don't we start with James, maybe some ideas, and Sandy, if you've got some ideas, and then Melissa.
What we can measure trust is quite intangible, but what we can measure is really the outputs of trust and perhaps confidence in the regulatory partners you're working with. And I do think that a good measure would be the number of projects where you have either done work sharing or joint assessment, or the fact that you actually say that you rely on the agency. Now, on the very last point, I do hope to challenge the current notion that when we say reference agencies, it refers to the US FDA, the EMA, and the TGA, and the biggies, the big reference agencies. Now, we all have been very familiar with them. We're all very used to the notion of when people say that we reference those because we trust them. But I think we also need to move to another level where can we identify regional reference agencies? For example, maybe in Asia Pacific, we have Australians, we have the TGA, we have the Singapore also reaching the ML4. So I think in many ways, the reason why I support this is because in terms of the cultural, the epidemiology, the clinical practices, risk appetite are a little bit more similar, given the geographical nature, understanding and working relationship amongst the countries, where referencing a decision seems to be more logical and extrapolatable, rather than having to make up excuses why we decide to take up a US FDA decision or the EU decision.
Right. Yes.
So that's one, and I would think that a measure of trust is therefore the number of projects where you actually place on a member, another country, and this must obviously be some form of official recognition where it could be an actual approval. There have been cases where they've exercised cooperation, but the approval was not done. It didn't reach a full approval, but I'm really looking into a full approval because I do want the value of Reliance being realized through the possible the future access of an approved product. So I do think that in terms of matrices and everything, the approvals of products through Reliance products, through Reliance approaches is actually still a valid measure.
That's very good. Melissa, have you had this conversation internally about trust?
Oh, yes, a lot. It is really multifaceted too, right? Because you're looking at sameness if you're looking kind of at a broad level of how you can trust.
Yes.
So do they have the same regulatory processes, regulations? Do they make similar decisions? Is our thinking aligned? What is the level of existing engagement we would have with that agency, for instance? So there's no real formal algorithm to sort of put it in and then spit out that this should be a trusted regulatory agency, that's for sure. But there's also multiple levels of trust. And when I think internally, you have, trust at kind of a higher level. So the policymakers, et cetera. Then you kind of go into the management level and the trust there. But then really what matters is that the reviewers who are peer reviewing, et cetera, or relying on a pharmacometrics report from another agency, trust that was done in the manner that they would expect so that they can rely on it. And I think there's a few thoughts that come to mind there. And one is that we learn by doing. So we can really only build that trust at that level by doing and experimenting and understanding. And that's really, you have to learn by doing there. But also giving our assessors the regulatory cover to rely on some of those things. So I think there's a couple of aspects there, and we talk a lot about how to facilitate it right down to that level. And I think we're getting better, but again, it's really I think a time and an opportunity question.
Yeah, thanks. And Sandy, do you have any final thoughts about this?
When I was a former regulator, when we worked at ACSS at that time, when I was still with the Singapore agency, as Melissa described, I recall like we, took turn to fly to visit each other and host meeting. We took turn, right, to host meeting in the agency. This is confidence building. This was like more than 10 years ago. Now, as somebody mentioned, right, imagine this wouldn't happen 8 years ago, but now if you look at what COVID in one way or another, right,
Yes.
it brought all of us together essentially. And I cannot forget, I think, let us not forget that during that time, how, I won't say easy, but it didn't take us too long, right, to say I need to call the company now and pick out the phone and call and say I need some answer. Can you give it to me now by tomorrow?
Right.
So I uh, the, so now it is, and also we look at the environment is like, we know that reliance is not just for a pool of regulators, it is for everybody.
Right.
And it is the way of coming together as a community, to make sense of, product that is needed globally, and doing it together in an efficient and robust way. So I would say now this trust building is there. It's just how we bring it to another level, and implementing it tangibly, with this trust that has been built over the past few years.
Well, that's really great because it kind of leads me to my next question, and it was the one that was posed to James about this concept of data collection and registry. And what we saw with the Relianomics work that we started on is that we had a slice at a point in time, but this is very dynamic, right? And we have to continue to be creative and think of new metrics and new ways of assessing reliance. And it's actually, I think, a science to be able to say, how do we know we're moving in the right direction? And so, what kind of experiences have you all had with regard to thinking about how do we look for the next measure, the next way of assessing whether or not our efficiency or effectiveness is moving forward? Not that you have to come up with specifics right now, but what are the kinds of things that we should be open to and thinking about? Just to say, in Relianomics, we talked about different categories, things like societal and economic. And I've had people push back and say, you'll never be able to measure societal impact. Well, I said, well, if that's the case, how do we know that reliance really did help our patients if we're not measuring that? If we're not measuring maybe the way that medicines are being taken up or being used, if we're not measuring it, how do we know it's happening other than saying it's great,
Right.
this is wonderful? So how do we keep ourselves open to these things that may be really hard to measure today, but maybe 5 years from now, a lot easier? And I don't know, James, you've been working with these registries. Do you have any thoughts about that?
Well, Larry, I think the first most logical observation is that we have always been using the same metrics, even before Reliance and everything, and everybody used this as a measure of how well the regulators are doing, how fast and how effective they are in actually approving drugs in a timely manner. And I do think that there is some utility in the existing measures. And I don't think that we need to go and start another new round of find new metrics for us to just because of there is regulatory reliance. But the thing is, having to validate the usefulness, okay, of these same endpoints in measuring it just for the particular value of reliance might be something that I'm going to give more thoughts to that. Okay, and then to be quite honest, just as Sani, being a former regulator, upkeeping a database of all the timelines and the changes, okay, to an application is extremely tedious. So what we can do in Singapore, in fact, might not be replicable, in fact, in some other countries. If you're using an Excel database, it can imagine it's 5,000 drafts, keeping track of them for 50 years, and it's just not possible. So why are we thinking about what we can introduce something new? But I would say that there should be further studies, I would say, to validate the usefulness of existing endpoints. And I will say, I honestly tell you that I don't think it's just big science. It's just basically someone to validate and say that, yeah, it is what we expected. It is equally useful to say that these endpoints are therefore good to say that reliance are a part of the part of the regulatory processes, and it does have value in terms of bringing the benefits to the healthcare. And we all know matrices, in fact, are just surrogates, and they're not the actual endpoint that we want to have the impact on the healthcare. But I must definitely mention that whatever we measure right now are really just milestones in terms of the progress. And it's definitely not the endpoint. But if we do well as part of these milestones, then at least we can predict the good things that will happen at the end of the day. Right. Thank you.
Brilliant, brilliant. Sani, do you have any thoughts on this? Because one of the things that I've heard is that internally within a pharmaceutical company, there can be a debate whether or not a reliance pathway should be used. it takes effort on the part of a company to actually be sure that these things are working. And so, are there metrics that are collected internally, and just are there processes that are used to say, hey, we used reliance in country X and seems to have worked well, and we learned why from that. So, what's been your experience about how a company looks at the value of reliance?
Y- yeah, I think it takes all stakeholders to collaborate, right, and work together, and a willingness to step forward and try, right. If you don't try, you will just be talking about it theoretically, and just get into it, and start working on it. Do you can you measure the immediate impact? Most of the time, maybe not. The easy quick outcome you may get is really a reduction in timeline. um, then as you try more, you and discuss more the regulators, with stakeholders, I think certain things potentially could be a good indicator would be you getting, let's say you used to get 20 questions, but now you're getting, let's say, 5 questions or 2 questions. Not that the evaluators are not reviewing, they are still reviewing, but very, very smartly using the work already been done by the stringent authorities. The second indicator could be that the requirement becomes more harmonized, right? As I explained earlier on, that the agency used to ask for additional stability data, although FDA, Health Canada asked for the same set. They say, I want more. Um, and as
Right.
as we know, right, more data means more time is required, right? So as the years go by, you see that it becomes harmonized. So potentially one set of requirement, one global dossier to go across. Yeah. So
Well,
just
let's
two
let's
of them
pray for that.
for now.
Melissa, I'll give you 1 minute for your final thoughts, and then we'll wrap up. Okay.
Okay, thanks so much, Larry. I could not say things better than James did in terms of not necessarily needing new metrics, but needing to be thinking a little bit outside the box about those intangibles, and how we could demonstrate those a little bit. And I have to say, thinking about a functional registry, I'm going to be thinking about that for a while, James, because I think that, our transparency initiatives are not necessarily done for benchmarking. They're not necessarily fit for purpose when it comes to these metrics. And so I do think we need to think about that internally and externally, but how we are thinking about functional registries in terms of putting forward what the benefits of reliance are. So I'll stop there. Thanks.
Excellent. Well, look, this has been a very, very special session.
Yes.
We believe that reliance and these related interactions that we've talked about today are valuable. We know we've taken steps to understand how to better measure and assess the value of these activities, and that's why we've proposed this concept of Relianomics, and this overarching way to encompass the varied types of beneficial and sometimes difficult aspects, as you've talked about, of implementing reliance, and to drive this more holistic approach to understanding the reliance's place in regulatory arena. Thank you very much for your brilliant insights. So, just to summarize, I think there are a couple of learnings that we've come up with that we'd like to leave you with today. Um, firstly, we should consider not only those quantifiable benefits, but also those that are not as easily quantifiable, as you just heard. And so let's think about how to optimize the use of the measurable ones, but also go a little bit beyond that. For the regulators, among the different ways of doing regulatory cooperation, let's think about, what do you think your organization can best support at your current stage? Can you justify it? Can you justify using this risk-based approach? And how do you measure that? And for companies, can your knowledge of the regulatory landscape for that particular region that you're covering help you recommend the most suitable mode of regulatory cooperation? And again, is it based on some sort of an assessment, a model? And finally, appropriate indicators can help us assist in tracking the progress of reliance pathways and implementation. And I think this concept of these registries and what others have done in this area is, excuse me, is a great learning from today. So I'd just like to finish up by saying to remember that a recording of this session will be archived shortly on the FR Path website. And we hope you will use the suggestions and observations today to actually move your activities forward in a practical manner. As a reminder, our next webinar will be held on Thursday, May 18th, and we'll be looking at considerations for optimizing the use of reliance-based regulatory pathways. So this is kind of the next stage in building on this year on this topic. So once again, Mario and I would like to extend to you all a very special thank you, especially to our guests, Melissa, James, and Sandy. Remember to visit the FR Path website to learn more about reliance and other pathways. We will be posting a white paper about Relianomics on the FR Path website. And with that, Mario and I would like to thank you for your interest and for your participation, and all our best until we meet again. Thanks.
Well,